Hello everyone, in this video we are going to discuss about dyslipidemia. Dyslipidemia is the clinical condition levels of lipids are deranged in the body, like total cholesterol more than 200, LDL low density lipoproteins more than 130, triglycerides more than 150, and SDL less than 40. We can see some of the features like xanthomas in the knee, xanthelasma in the eyes, around the eyes, deposition of fat, and lipema retinalis, the creamy appearance of the retinal vessels. Let's see some of the causes like obesity, diabetic mellitus, alcoholism, hypothyroidism, nephrotic syndrome, hepatic disease, Cushing syndrome, OCP, high dose of diuretics, and familial hypercholesterolemia. If the level of total cholesterol is more than 200, then we call it hypercholesterolemia. So for diagnosis, we have fasting lipid profile. We can do it when the patient has age more than 25 or with the patient more than 20 years with coronary artery disease risk factors. We should repeat the test in every 5 years. So we see total cholesterol more than 200 into different occasions to label it as hypercholesterolemia, LDL more than 130, SDL less than 40. For treatment, we have 12 weeks trial of diet. Diet means those diets which have less fat and omitting the alcohol and other things the diet, and exercise in the patients with no non-atherosclerotic vascular diseases. So for LDL, if LDL is more than 130, we call it dyslipidemia. So how can we start treatment? If the level of LDL is more than 190, then first goal should be reduced to 160. It can be done by high intensity statins like atorvastatin and rosuvastatin. And we repeat it after 4 weeks. If the LDL is less than 100, then we continue. But if it is still more than 100, then we add ezetimibe, and again we repeat the test. If it is still high, then we can add PCSK9 inhibitor. And if it is more than 160 with more than 2 coronary risk factor, then our goal should be up to 130. If it is more than 130 with coronary artery disease and diabetic mellitus, goal should be 100. If it is more than 100, then with previous MI, we should start the treatment. And if triglycerides is more than 200, then we should go for the treatment. So let's see some of the drugs. Most common use is statins, that is HMG CoA reductase inhibitors, like atorvastatin, simvastatin. Its main mechanism is inhibit the rate limiting steps in cholesterol synthesis. It is the rate limiting enzyme. It is useful in reducing the LDL and triglycerides. We saw there are some of the side effects like deranged liver function test, myositis, warfarin, and potentiations. Lipoprotein lipase stimulants like fibrates, like phenofibrates we can add, or gemfibrazoles. It is used to reduce the triglycerides and increase the SDL. Cholesterol absorption inhibitors like ezetimibe, we just saw ezetimibe. Like niacins can be given to decrease the fatty acids released from the adipose tissue. It is useful in increasing the SDL and reducing the LDL. And bile acids resins like cholestyramine can be given to reduce the LDL level. It has some side effects like constipation, GI upset, liver function test abnormalities, myalgia, and that's all. Thank you.